Good evening all. I am Dr. Sonia Bhatt, Professor and Head Department of Pediatrics, FH Medical College, Agra, and today we'll be talking about a very common symptom, cough. So now when we say a patient or a child presents to you with cough, should we suspect that this cough is due to asthma? All of us know that asthma is a highly variable disease. It's a heterogeneous disease which is characterized by chronic airway inflammation, and it has many symptoms. So cough is one symptom of asthma. Cough, a child who presents with the history of cough, history of wheeze, history of shortness of breath, and chest tightness, that is especially in adolescents. A chest tightness may not be a history in small children. That is a characteristic feature of asthma. So isolated cough alone is very less likely to be asthma. Apart from that, the symptoms of asthma are highly variable. So what do you understand by variability? That these symptoms may change over day to night. They may change from season to season. So many a times a child may remain asymptomatic for a long period, and that is how, because the cough in asthma may either respond to medications, and many a time it's self-resolving also. So it always gives a confusion to the parents as well as pediatricians or physicians when to label this cough as asthma. So there are few pointers which will tell the parents as well as the physician that this cough can be asthma. A cough which is recurrent, that means a cough which goes with then again comes back. If a cough is recurrent, it is a very high chance that it could be asthma. A cough which is dry in nature, asthmatic cough is usually dry in nature. So if a child comes to you with wet cough, a child comes to you with many other things, like a child is having persistent cough, a child is having wet cough, a child is having failure to thrive, this is less likely to be asthma. Apart from that, you should always take a good family history. The history from siblings, it's not only the parents, take a history from grandparents, from the maternal uncles. So a history is very important. A child who has history of cough which increases whenever he is exposed to some stimuli or triggers. So what are these triggers? The triggers are certain stimulating factors which may exacerbate cough in a child with asthma. A child who has suspected asthma, he will have history of cough which increases on triggers. These triggers could be anything. These triggers could be allergens, like the allergens which are present at home or the outdoor allergens. So then there could be certain irritants. So what are allergens? The allergens are the triggers which increase the cough due to IgE mediated mechanism. So the allergens like house dust mite, cockroaches, pollens, if you get a history like this is more likely to be asthma. There may be certain irritants also. So these irritants are the pollutants, the fumes. If a child is having history of exacerbation of cough due to these symptoms, it's again points that this child can have asthma. Apart from that, there are certain precipitations or precipitants like viral URTI, like emotional stress, like a child having cough after exercise. These again are the pointers towards asthma. Apart from that, many a time you would get a typical history from the parents, because if a child is an adolescent, he might give you history of effort intolerance. A child may get cough while exercise. But what do you do when you get a toddler? When you get a small child, so you'll get a typical history from the parents that they might say that their child coughs when he cries, their child coughs when he laughs aloud. And many a times, a very important feature of effort intolerance can even be a child who doesn't want to walk, who doesn't want to play with friends. The parents may not say that this child is coughing, but they'll say, my child wants to be carried in lap, he doesn't walk. That's also a sign of effort intolerance. So these are few features which will tell you that this child, probably though he's not having typical symptoms, you might not get wheeze, but these are the pointers where you should specifically think that even this child is not having recurrent cough, or this child responds to medications. Another very important thing is, many a times the parents may say that this child has been given some inhalational therapy or nebulizers in the peripheries, in the outskirts. Many a time oral bronchodilators are used. So you might also get a history that this child has responded to some kind of oral bronchodilators. This is also a thing where pediatricians should suspect and then talk to parents on these important points, that these are the things where a cough can be asthma. So again, I'll say that isolated cough, unlikely to be asthma. If this cough is being associated with wheezing, and again, many a time we are in a dilemma that how do we say, because noisy breathing is wheeze, is common for every, so the parent may come that my child has noisy breathing. How do you say that this sound is wheezing? So there are many important things which you can tell the parents. Like nowadays you have good mobile phones, recorders, so you can tell the parent to record these things, and when they come to you, you'll have a very good objective way of seeing that this is wheeze or not wheeze. So please keep in mind all these things. So good family history, a history of a cough getting exacerbated or wheeze getting exacerbated by the triggers, a dry cough, a cough which is more at night. Nocturnal cough is a very important symptom, because at night the inflammatory mediators go up, the counter-regulatory hormones like cortisol, epinephrine, everything is going down. So a nocturnal cough, a cough which increases on efforts, a cough which increases its triggers, a dry cough, a good family history will definitely help you to point out if this is a benign cough or an acute viral cough which will settle it on its own, or is it a cough which is pointing towards asthma. Thank you.